As a police officer, you will encounter people in suicidal crisis. These situations can be emotional, confronting, and sometimes unpredictable and stressful. Therefore, it's essential that you have skills to navigate these situations effectively. The Behavioural Influence Stairway model, or BISM, has been used for over 40 years by police negotiators to help navigate high-risk situations. BISM emphasises how you can use communication skills to develop a relationship with a person, to influence behaviour change, and to safely resolve a crisis situation. The following information will not make you a qualified police negotiator, but it will provide you with an understanding of how the BISM can be implemented in real-life situations. The BISM has 4 steps: active listening, empathy, rapport and trust, and influence. The first step is active listening. This is the foundation of BISM and underpins all facets of the model. You will need to listen attentively to start to understand the perspective of the person in crisis. The goal is to make them feel safe so that you can then determine with them their needs and concerns. Active listening involves referring back to key parts of the conversation at important moments to show the person you are listening to what they are saying. It's also important to pay attention to the tone of voice a person is using, as well as the pitch and pace of their voice. Empathy, the next step, naturally develops from active listening. Cognitive empathy refers to methods such as perspective taking, critical thinking, and inference, which allows you to maintain distance and objectivity when working with a person in crisis. A key part of developing and conveying empathy is the tone of your voice. Your tone of voice can reflect genuine concern to the person you are talking to. Examples might include, "I'd really like to understand what's causing you to consider suicide," and "I can see why you would be frustrated by that." Rapport is the establishment of a relationship characterised by good communication and respect. This can be developed into trust, where the person in crisis believes the negotiator to be reliable and truthful. Once trust is gained, then the person is more likely to feel comfortable working with you to find a way to stay safe. Rapport can be built when there is a genuine effort to connect. Just because you haven't experienced something doesn't mean you can't empathise. For example, you may have never been in the military and come under fire, but you can understand that that would be a very stressful situation. You can test the rapport you've built by asking the person to do something minor, like nodding their head to show they understand. These requests should be made kindly and gently without an expectation of compliance. If they do respond, acknowledge it with genuine interest, empathy, and gratitude. The last step is influence. Once a trustful relationship is established, you may be able to give advice to the person in crisis. As a result, you could suggest a course of action and work together with the person to find mutually acceptable solutions to the current situation. At this point, it's important that all officers that are present respond respectfully and maintain the trust being shown by the individual. Remember, someone close to you could experience a crisis one day, so consider how you would like them to be treated. What outcome would you want for them?